don't need to do the Shark Tank part of it, but I will. I'll cover that. Just want to say on the speed dating side of it, community health workers are passionate. They want to live healthy, full lives, and they want to do that for other people in their community. So they're caregivers. So this is my pitch to you all to make sure that community health worker leveraging this benefit is something that continues to stay a priority for the next 2 years as part of the California State Oral Health Plan. So for those of you who don't know me, I work at Children Now. We're a state-based children's policy advocacy and research organization. And basically the key takeaway that I want you all to understand is that all the different priorities that we're talking about, this could all be leveraged and realized if we fully leverage the community health worker benefit. This is a key opportunity to truly improve oral health outcomes. So community health workers, I'm just going to keep it at that, but they're also known as promotores. They're also known as representatives. So I'm just keeping it to community health worker for now. They can address already through a state plan amendment that was approved and put into implementation in July of 2022. These are all of the services that they can address. So I bolded the ones that I wanted to kind of lift up for this audience in particular, but I want you to know that community health workers now can be reimbursed for doing these services as of July 2022. Yes, definitely. Yes, yay. That this is, yeah. And you know, they have existed for longer than the benefit just got implemented, right? So I think this is really a recognition of the great services that they provide to the community in culturally competent, congruent, humility. Like they're the ones that are going to be those trusted messengers to provide the oral health literacy messages, to provide the oral health education, to help that Medi-Cal member get access to the care that they need. And I'm talking all, of course, about oral health. So these are some of the covered services that a community health worker can reimburse for. They can provide health education. This includes the motivational interviewing that I know that you all have been engaged with in your local oral health programs. So this includes the coaching and the goal setting that might be required. They can also help navigate that Medi-Cal member to care. In my opinion, they can help fulfill closed loop referrals that are going to be a requirement of the Medi-Cal managed care plan starting in 2025. So they can help make sure that an appointment made is an appointment kept. Right? Exactly. Thank you, Dr. Fine. I didn't pay him that much to do that. So other covered services, they can help screen, they can help assess, they can help provide individual support and advocacy. So just a little footnote, the screening and assessment has to be something that doesn't require a license. And then the individual support and advocacy is to assist that beneficiary to prevent the onset or exacerbation of a current condition. So it could be, geez, you know, it looks like you have some decay and we want to prevent that from happening. Or, you know, do you need help finding a dental provider? What is it that you need in order to get that care? It may not be that they need to go to the dental office. So let me just make that clear. It could be that maybe it's a home visitor going to their home and doing an assessment of the home. It could be, oh, are you sharing toothbrushes? Let's figure that out. There might be other ways to mitigate that oral health condition. So we were also asked in our Shark Tank pitch side to kind of talk about how we're doing now. How we're doing now, I think there's a lot of room for improvement. I am a children's policy advocate. So when this kicked off as a benefit and started to be administered back in July 2022, Department of Healthcare Services did ask all of the Medi-Cal managed care plans to submit what they call CHW integration plans to figure out, you know, how are you, Medi-Cal managed care plan, going to educate not just your provider networks, but how are you going to educate the Medi-Cal beneficiaries, the ones that you are to be providing care to, about this benefit, how to leverage it. It could be administered by a Medi-Cal provider saying this particular member needs a community health worker. It could also be a Medi-Cal member saying, I have 5 minutes to go to cover this all. It could be a Medi-Cal member saying, I need a community health worker to help me. So it could be a very bi-directional way of getting the services that Medi-Cal member needs. So how we're doing now, I am aware that there are some Medi-Cal managed care plans that are struggling with how to provide that education to their provider networks, I would say on the medical side, of how to educate their members and their providers about using it to get to the fee-for-service dental side, right? You have two majority state fee-for-service. So trying to figure out like, how does a Medi-Cal managed care primary care physician know to say, oh, you need a CHW for a dental thing? Like, how do I do that? So I think there's a lot of education that can happen still. But I want to just highlight those integration plans are so key. This is feasible in the next 2 years because there are already laws and regulations around this. There's already money going towards this. You already have community health workers that once the Office of Healthcare Access and Information finalizes their training and certification program this July, that community health workers will then be able to take the training and certification necessary in order to get to bill Medi-Cal. So there are so many things in process that I really want to encourage the oral health community and stakeholders not even in this room to really leverage and make sure that oral health is realized through this benefit. Because if we don't get in now, my concern is that we're not going to get in. And that's a disservice to the children and families that we serve. So what would progress look like in the next 2 years? For one, just really making sure that this workforce that is now finally getting reimbursed for the services that they're providing feels supported, feels recognized, doesn't feel exploited, feels like they're truly part of the care team that is part of delivering the Medi-Cal services. Also that they're sufficiently trained to provide the oral health education that we want to see. And what else did I put up here? There's more progress that could happen in the next 2 years. The guidance, again, I talked about this earlier, the guidance that providers and members need to activate the benefit. And then, as I mentioned earlier, to get some clarity around closed loop referrals, I want to say that again, closed loop referrals are part of the population health management strategy that the Department of Healthcare Services has talked about, where it's figuring out everything that that Medi-Cal member needs in order to be in the optimal health condition that they could possibly get to. And that includes, as we all know, oral health. So along with the theme, we're going to turn the curve if we really leverage this benefit to the full extent. And it's not, you can access these links, which have the state plan amendment language, has more resources about the community health worker benefit, and you can get that all through the QR code that I think Lindsay mentioned earlier. So thank you. Don't forget community health workers.